for joining us on Intune. I want to welcome all of our new viewers and listeners that have been tuning in from all over the world. We are so excited to have you. For anyone who may be new, the concept of Intune is so important to me because I think it's really at the core of how we can feel our best and live our fullest lives. And being in tune means being connected not only to ourselves and what makes us who we are, but also being connected to everything around us in our world and all of the relationships that really matter to us. I'm so excited to introduce our guest today. She is a thought leader in the world of endocrinology. She has been in that space of hormone health for over 20 years. She is an advocate for women's health and helps women live their best lives. She's also a Yoga Alliance certified yoga instructor and an all-around great person. Welcome to the show, Shamita Trivedi.
Thank you so much for having me, Isha. It's an honor to be here.
Well, this topic I think is going to resonate with so many of our viewers. So, a lot of times when we get to be in our midlife and we are just not feeling like ourselves, maybe we're fatigued, maybe it's hard to handle all the stress and all the pressure in our lives, we start to wonder, what's wrong with me? And we've been hearing about hormones when it comes to perimenopause and how they can affect us. And I would love to hear more about what that process is actually like.
Yes. So it's interesting, when we talk about midlife, we are taught in our medical training that menopause is one single point in time. It's 12 months after your last cycle, and then you're in menopause, and you just right off into the distance. But actually getting to menopause, the 5 to 10 years before that, there's this huge kind of, it's not really a steady hormonal decline of that estrogen and progesterone. It's like a wild roller coaster that happens. And so I think that acknowledging that it's not a single point in time, there is a roller coaster of hormones that happen leading up to that. That kind of gives a little bit of solace for my clients. And then the things that most people experience are probably things that most people experience. So if you talk to another woman in the same phase of life that you're in, they probably are experiencing the same things. So that kind of camaraderie has been amazing to experience in this space as well.
Yeah, so then how do we know that what's happening? How do we know this is not just like a normal part of life versus something deeper having to do with these surges and changes in our hormones?
Yes, yeah, that's a great question. So one of the things that I usually say, because oftentimes when women seek care about the symptoms that we're experiencing, there's a few things going on. The first thing is, in a traditional practice, you have 10 to 15 minutes on a good day with your provider, right? So the time is shorter. The other thing is that there hasn't been a lot of research on women in midlife or women's health in general. Luckily, that's changing now, but I feel like there's a knowledge gap unless you've had like deep hormone training, like maybe someone like me. And I even did further training to make sure that I understood this area of life so much more specifically. So unless you're seeking it out or it's in your training, like endocrinologists, gynecologists, it's really kind of going to be the Wild West out there. So it's interesting that a female can go to their doctor and say, I'm tired, I'm not sleeping well, my anxiety seems kind of strange now, I've never had anxiety before. And more often than not, she'll be given an antidepressant. And whereas if a man goes into a clinic and says, Doc, I'm feeling all of these things, low energy and all that stuff, he might be given testosterone, or hormones would be an option for treatment for that person. So we just want to level the playing field that, hey, that might be an option for females too. And there is data behind having a really safe way to do that.
Well, and I want to talk about what you just said about getting an antidepressant rather than really diving deeper into what's going on. So if that happens to, say, one of our viewers, how would you suggest that they handle that situation?
Oh man, that happens so much more often. I would say that's the majority of what women in midlife experience. So the first thing that I usually like to empower women with especially is that if you feel unfortunately dismissed, you don't necessarily you're probably very frustrated, which is well within our right? But it's not that we need to get confrontational. We do, not that we would, but we do, I always say, we do need to get specific. So instead of saying, I just don't feel like myself, which we were talking about is one of the most common things that I hear with the clients that I get to help, maybe we say, you know, I'm waking up at 2 a.m. That has never been an issue for me before. What could that be due to? Or my anxiety is, I've never had it and it's really out of proportion with what I have going on in my life. Why would that be happening? So that's the first thing, is get really specific, because then we turn to, instead of dismissal, we're turning to information, right? The other thing that I say is, let's say that it's kind of, oh, you know, that's the age you're in or whatever. Then the next question, and this is a really powerful one that I empower my clients to say, and if they're in my clinic, they've probably already tried this, but when I get to speak to women going through this, one really powerful question is, okay, if it's not, you know, if it's not my hormones, then what else could it be, and can we rule that out? Then you pivot from dismissal to investigational, right? So those are two really, really big things that I think are important. The third one is, it's okay to seek a second opinion. Oftentimes, I would say probably 30 to 40% of my new patients, I am the second opinion. They've already met with one or two providers and they maybe their cares haven't been, or concerns haven't been addressed. And so then they come to me. Conversely, if I meet someone for the first time and they don't feel comfortable with their care, I empower them that you should go get a second opinion. I wish that I could be the one to help all of the people. But if it's not me, I just want you to feel comfortable where you're getting your care. That's perfectly within your right, and it's normal.
I think that's such a powerful message, and I want to thank you for putting that so eloquently. You know, that's very much aligned with the concept of what it means to be in tune. So if you're going through a phase of your life where you don't quite feel like yourself, you seek answers from your medical providers and you find that they're not really understanding, it's okay to advocate for yourself, to seek out the right provider for you, and it's okay to get a second opinion.
Absolutely, absolutely. And like I said, I hope that most providers and physicians are like that. I know that that's probably not the case, but like I said, my attitude is I do want you to feel comfortable with where you get your care. Yes. And I think if you make it patient-centered, yes, which is how we should all be practicing medicine, then it just flows naturally from there.
Yes.
So I think that's really important.
And so once women meet with you and you talk to them about what's going on with their health, and we find that maybe it does have to do with the way their hormones are behaving at that time, what are the next steps you talk to them about?
So the next steps would be talking specifically about the symptoms that person is experiencing, and then talking about family history, what's been going on, what age did their mom or aunts or sister go through midlife and menopause and all of that stuff. Is there a family history of breast cancer and things like that? We have to talk about all that stuff. So the other side of getting care is you want to make sure that you're under the care of a provider who knows the data.
Yes.
And so then we do talk about the most common hormones that we talk about are estrogen, progesterone, even testosterone for women. There's a lot of options out there and there are safe ways to do it, but you have to have someone who knows what's safe for you.
I think that's so important. Yeah. And I hope our viewers realize the importance of that, seeking out care from someone who takes the time to kind of dive a little deeper into your history and also really understands the process. I think you have to have both components.
Absolutely,
yes.
Absolutely. And I think that it doesn't have to be difficult. Like what I say is that these things usually end up flowing the way that they're supposed to, yes, with the right person.
Yes.
And so when you lay everything out there, just see what comes from there. And then if it's what you want and it makes sense for you, that's great. And if not, you can still pivot, you know?
Well, and I think that's great advice.
Yeah.
One of the things I've learned is the way we feel and our emotional health and really the life circumstances going on in our lives at the moment can impact our health immensely. So, when you meet with women who are maybe in this stage, are there often other things going on that are adding to that? So it's not just the hormonal shifts, but it's life itself.
Absolutely.
Yeah.
So one thing I say is I take like kind of a layered approach to replacing the hormones, to which hormones we choose to replace and the time point that we do it. And once we get things moving in the right direction, I always say I have two pieces of information in front of me. I have what the numbers say, and as an endocrinologist, I do draw labs. There is a lot of information that can be gleaned from a good set of the right lab testing. And then I have the person, I have that beautiful human sitting in front of me. And if the numbers say, hey, everything's okay, but that person is telling me, hey, I'm still not okay, we're gonna find a happy medium in there. So I'm not just gonna treat based on a number.
I love that. That really stays with me, what you said about here's this beautiful human in front of me. That's really what our care should be about. And yes, we need the numbers, we need the data because it helps us to track your symptoms, how you feel, what's going on maybe inside. But really, one of the biggest components is what you feel and how you feel and who this person is that we're treating. So I love that. And one of the things I've started prescribing to my patients is simply time to learn how to regulate their bodies and their nervous system. So do you ever prescribe things like meditation or going outside doing grounding work?
Yeah, so that's a great question. So in my office, where I get to help all of these amazing people, like I have the coolest group of patients, but I have weights in my office so I can demonstrate, just easy workouts that can be done safely. I am not a personal trainer, but just some demonstrations there. And I have a yoga mat in there. And so, so people see that when I'm talking about like, do some breathing exercises, do some grounding work, see the morning sunlight first thing in the morning. There's a method to why I do that. And there's a reason, because I'm kind of talking the talk, but I'm trying to walk the walk too. So I do think that there is dysregulation of the nervous system oftentimes for a lot of phases of life, but especially in midlife. And it takes getting the hormones right, maybe work-life balance, addressing, neuroregulation, all of those things. It's not just one thing.
Yes.
It's all the things.
I agree. And that was one of the reasons it felt so important to me to create Intune, is so that we can remember that you don't have to choose one side or the other. You don't have to just go in for a medication every time your body doesn't feel well. There's so many other parts that are involved in creating our overall health, and we have to kind of look at everything. And taking the time to ground ourselves and manage all those things that are disrupting our nervous system day to day, in addition to getting the appropriate medical care from the appropriate provider. That's really what it's all about.
I love everything you just said. And I hope I'm sure that message will resonate with your amazing viewers for sure. But it definitely, it takes all of those aspects.
And I love that you have a yoga mat in your office, because you have also had this other part of your life that has been devoted to teaching yoga. And how has that influenced how you think about treating your patients?
It's been, they kind of go hand in hand. It's been really seamless, which has been great. One of the things that when I was doing my yoga teacher training, I wanted to do it at a studio where I would have gotten the same yoga teacher training had I been in India. So it was a really, really traditional studio. It was very tough. There's a lot of like personal work you have to do to get that Yoga Alliance certification and all that stuff. But it's really been seamless in incorporating it, because part of hormonal regulation, aside from supplementing them back, is keeping them steady, right? And all of those other aspects of yoga make a difference there. So I am very honest with my patients, and I say, listen, I got into yoga because I wanted to stand on my head and do cool arm balances and all of that stuff. And then of course life happens and your yoga practice deepens and all that stuff. So then the grounding and all of that stuff came secondarily for me. But I'm so thankful that it's there. And there are so many, even just breath work, pranayama breath work is so important for feeling grounded and like getting out of fight or flight and getting back into rest and digest and all of that. So, and there's a role for all of that.
I want to talk a little bit more about this breathing work, because I think just having some simple techniques to just regulate your breathing can be so helpful in a situation when maybe you're feeling anxious or stressed, anything. And I know there are a lot of different ways to do it, but one of my simple tips that I tell my patients is, even if you don't remember anything else, even if it seems complicated, because there are a lot of methods of breathing,
ways.
I just tell them, just start to slow down your breathing rate. If all you do is just actively say, I'm going to slow down the number of breaths, you do calm your nervous system. You do get out of that stress mode, fight or flight mode. So is that something, even if they simply just do that?
Yes. So I do think I add a little something extra where I say you can start with inhaling on a 4 count and exhaling on a 6 count. The other thing that some people, because a lot of us are turning, even those of us who are physicians, and we're no longer running around the wards of a hospital all the time, right? We're having to chart at our desks. So even when you're sitting at your desk, maybe both feet are on the floor and you're putting one hand on your heart and one hand on your belly, and you're doing this deep breathing. And of course it's longer than that, but you really want to move that one that's on your heart. You want that hand to move up, and you want that one on your belly to move out. So you want to have exaggerated breathing. And even by putting your hands on your own body, that's grounding in and of itself. And so just moving through that part of it also makes a really big difference.
That's a great tip.
Yeah.
And when you are meeting with women who are going through these hormonal surges, and at the same time, they're maybe in a phase of life where they're facing challenges, often we just get to this space of being burnt out. Do you run into that?
Oh my gosh, so much. Yeah, it comes part and parcel with midlife, right? We become part of this amazing sandwich generation where we're caring for our kids, and then we're caring for our parents and other, young people and old people in our life. So there is a lot. There is a lot to burn out.
We're in the middle of that sandwich. Is that what you're implying? We have to be responsible for the older generation, the younger generation. Forget about us. Forget about the sandwich filling.
Exactly. That's so true. So when we talk about burnout, and this is something that I'm super passionate about. So we've gotten really good at defining burnout, and you have feelings of emptiness and you can't possibly go on and you're drained. And the WHO classification pertains only to your job or professional life. We know that burnout happens in home life.
It's so much more.
It's all across the board. But I feel like there's not enough rhetoric on how to move through burnout, right? And so there are some tips that I love to give the women that I get to help, especially. So the first one is, as you said, I'm a yoga teacher, also in addition to being an endocrinologist. So I definitely believe in grounding and mindset and all that stuff. You can't mindset your way out of a dysregulated nervous system, right? So start with some grounding techniques like we already talked about, luckily, belly breathing, seeing the sunlight first thing in the morning, things like that. The next thing I talk about is reduce your invisible load. So what are you?
What is that?
Okay, so that is the things that you are doing that might not actually need to be done. And for women, especially women who are high achieving, who we're used to kind of doing everything for everyone, we know that. I'll give you an example. So I know that for my son's club soccer, that one of the kids has to get picked up by another family. And so if there's traffic, they're going to be, I don't need to, there is a very responsible person in charge of that sweet child.
How many narratives do we have going on in our minds at all times?
At all times. So another example that I'll give in my own life is when I get home, one of the things that I do is I, get the kids rooms ready for bedtime. I might help them take out their jammies or help them get ready for the school day the next day. They don't need my help with that. They're old enough to do it, you know? So maybe taking that load out. Now, I enjoy doing it and maybe it brings me peace of mind. So if that's the reason, then you can go on with it. But if it's a point of stress, they don't need that help.
I love the term invisible load.
Invisible load.
I
Isn't
think
that a game
most
changer?
of us can relate to this. I want everybody to think about what is the invisible load that you are carrying right now? And can you unburden yourself of some of that?
Exactly. It is something that is ever present. And I will say, a lot of us are not good at addressing how much of an invisible load we have.
Because we're the best at doing the things.
Exactly.
So how can we let go of that?
So you
to
have to
somebody else?
relinquish some of that control. So another example that I give to the women that I get to help especially is, you know, talking about dinner. So like maybe you're meal prepping, you're doing the groceries, it's Sunday, you're making half of all the meals so you can quickly throw it together during the week. But maybe we just ask for some help there. Either it's what I say is, you know, either it's 5 ingredient meals for a few times during the week, keep it simple. The other thing, and I have done the cost benefit analysis of this in my own house. The other thing is maybe you do a Blue Apron or HelloFresh or whatever, some sort of meal service. It's actually usually, depending on how you're eating at home, it usually works out cheaper to get their pre-portioned ingredients. Then you still have to find the time to make the meal. Hopefully it's quick, but that saves that grocery trip. And oh, I need star of anise, you know, which I know we all have a whole thing in our house for one recipe we might have made, right?
Exactly. I'm pretty sure I actually have that.
I'm sure you do. Yeah, we do. And so that's another thing, but just kind of get yourself out of that, adding stuff onto your plate.
So finding ways to kind of be a little bit more efficient and then also just letting go maybe of the need to do every single thing.
Right.
Because what's the worst that can happen if we don't have the star of anise or, you know, if we have one other thing that we don't focus on that day?
It's probably still going to be a good
okay.
meal. It's probably going to be fun, you know? And that's the other thing is relinquishing that control. So talking about efficiency, I wanted to touch on that. So it's not necessarily, it is some of it is efficiency and optimizing, but we need to think of it in terms of subtracting. Like what can I take off of my
Because almost when I hear, oh, you need to be more efficient, I'm thinking, oh, one more thing I have to learn how to do.
That's more work for us, exactly. But if we
point.
think about what can we kind of tease away and untangle, it kind of is very freeing, I feel.
It is, yeah. So it should be something that frees us.
Yes, exactly. It's not something that kind of just adds to our burden.
Adds to the burnout.
Exactly. And then the other tip for burnout that I like to give is this. We want to say, it's not I am valuable because I am productive. I am valuable and I'm productive. So you have to, and that one's really hard to do. That takes a lot of work to kind of, for me, I know a lot of my identity was being a physician and being an endocrinology specialist and knowing about this niche area of medicine. But that's not who I am. That is a big part of what I do. But am I also, you know, a yoga teacher? Yeah. Am I also a mother and a wife and a sister and a daughter? And there's so many other things that we are. So separating those two things is really hard, but it's worth the work. It's so freeing.
I love that concept. We have to feel our inherent value coming from who we are.
Yes.
That is all about what Intune means. And we attach our self-worth to other things outside of ourselves, whether it's our job, whether it's our kids, whether it's all the things that we take on as our responsibilities, some of which may include invisible load.
Exactly.
And really, we need to learn to love ourselves for who we are, value ourselves for who we are.
Yes.
And that is one of the most important things we can take away.
Absolutely. It's not, again, it's not I am a physician, so I am valuable. It's I am a physician and I'm valuable.
I love
so
that.
it's just separating that. And like I said, that takes a lot of work, but it's possible to do if you're willing to put in the time. And I love the concept of Intune because that is very, like I said, that's very freeing once you can even start working through that. And so if you can start working through some of these things, then that burnout, you kind of get some breathing room. You get a little bit of like, I can actually like come up for air a little bit. And slowly but surely that becomes your new normal.
Yeah, and I want to reiterate to our viewers that these types of practices may take daily work. It may not be something that you just learn and you're like, now I got this, I have my self-worth. And you do have to remind yourself of these things on a regular basis, but it's so worth it, like
Absolutely.
you said. Yes.
And it's not something that once you work on it, I mastered it and I'm there and I never have to work on it again. We all go through ebbs and flows,
Absolutely.
And so if there's days where you have to work on it more, that's okay. There might be days where it's less, But it's kind of like care in midlife. It's like your body isn't like failing you or betray or anything like that. It's just communicating something different. It's just evolving.
And it's a natural part of the process.
Exactly.
Absolutely.
Absolutely.
Yeah. Well, Dr. Trivedi, this has been such a powerful conversation. You have told us about recognizing some of the signs of perimenopause, about how to advocate for ourselves when we just don't feel right. You have talked about how important it is to incorporate work that grounds us and helps with our overall mindset and well-being. And you've also given us some great tips to get through burnout. I mean, what a
we covered a
packed
lot.
conversation. And I want to thank you so much for being here. I'm sure our viewers would love to hear more about you and your work. What's the best way for them to reach out to you?
Thank you so much for having me, my sweet, sweet Dr. Isha. So I am on Instagram. It's Dr. Trivedi _hormone doc. So DrTrivedi _hormone doc is the best way. And I just try to post just informational things that might help you as you're navigating healthcare in this phase of life or any phase of life. I also do have some reels where I'm just playing the piano and stuff like that too. So I keep it real. And then I do have a website, drshamitatrivedi.com, which might be a good place to kind of find out more about me, and I'd love to connect with you there too. So thank you so much for having me, and I hope it was helpful for all the viewers.
Perfect. Thank you so much. And I want to thank our viewers for tuning in, and we will see you next time on Intune MD.